Tony and Troy Starver, who is our faith-based coordinator at the Southwestern Pennsylvania AIDS Planning Coalition, just poured a fast one on me. They told me I would be speaking. They didn't tell me I would be speaking after that video. That video is about 2 years old now, something like that, 3 years old now. And every time I watch it, I am angry, I am frustrated, I am sad, and I have all those emotions right now, so please pardon me. I am the executive director of the Southwestern Pennsylvania AIDS Planning Coalition, and we have 11 counties around Allegheny that we are responsible for planning and finding out what the needs are around HIV/AIDS, and also some federal and state money that goes out to services, such as to the task force, who are then responsible for providing direct services. Let me tell you, the services are available. We just need to know that they are. But what I've been asked to talk about is some of the statistics, some of the numbers. We've heard some of the national ones. And I'll just give you a little bit about the local ones. But, you know, I want to use those numbers to challenge all of us around this disease. I went to a whole lot, I could give a whole day's workshop on numbers. Doesn't get any prettier, whether it's 5 minutes, it's 10 minutes, it's 1 hour, it's a whole day. For us in the Black community, it is not pretty at all. Let me thank all the groups that have come out, Pastor Mann especially, and then there will be the panel, and I really want to challenge the panel. And Kathy Boyle and the task force for using this National HIV/AIDS Awareness Day to rally the churches. There are a number of events that are kind of national celebrations around HIV/AIDS. This National Black HIV Awareness Day is one of them. It's actually today, February 7th. Then there's one, there's a whole week celebration around the church's response to HIV/AIDS, which Vanessa Sill, who was on the video, started maybe 20 years ago. And we have been marking this in the Southwest region for over 10 years now. The Balm in Gilead Black Church Week of Prayer for the Healing of AIDS. And we, the coalition, had dovetailed the start-up of that into this celebration because the Pittsburgh AIDS Task Force had chosen that faith component to it. I like their provocative question, am I my brother's keeper? I put it to you that we are our brother's keepers. Who has heard of the Balm in Gilead Week of Prayer? Just anybody? This is the first week in March, first full week in March, when we asked the churches to really put HIV/AIDS on their focus. And you did see in the video that the churches have been called to question. But since we've been working with the churches in the last 11 years or so, we've had a lot of responses. I have been in Pastor Mann's church. This was years ago, like 8 years ago, at the beginning of the Black Church Week of Prayer. There are a number of churches that have partnered with us, and I ask that more churches do so, more pastors do so. And I do challenge all of us to respond. Locally, we have pretty much the same problems that are national. Numbers or reports are sent to the Department of Health in Harrisburg, and then they pass it on to the Center for Disease Control in Atlanta. But for our 11 counties in this region, they have reported from 1980 to 2006 3,445 cases of AIDS. If you take 100 of those, 86 of them would be males. 60 of them would be white. 42 of them would be in age group 30 to 39. And if you look at what gave them the infection, it would be sexual activity between men. But then, if you look at, that is the total reported in that period, 1980 to 2006, for which we have numbers. But what is so disheartening about it, and I think that was pointed out on the video, was that if you take the time period from 1980 to 2000, and then you look at from 2001 to 2006, then you begin to see some of the problems that we have in the black community. If you took 100 of the cases in those two, before and after time period that I gave you, it was 12% before, and for female, it is now 21%. For black, it was 33% before, like 33 of those 100 before would be black. Now, 46 of them would be. If you look at heterosexual sex as a means of transmitting HIV, before, 7 of the 100 would be represented, but now 24 of that 100. So you can see that, it's like, I do, like I said, we could spend all day on numbers, and I could show you all kinds of bells and whistles and charts and things going up. If you look at it, it's taken off. More recently, they have given us HIV numbers. All the things I've said before were AIDS numbers. Now we have HIV numbers because, as you know, HIV is the beginning of the disease, and it would progress to AIDS if it goes untreated. Another reason for us to rally in the black community. There is treatment available. It is not shameful. If you're HIV infected, please ask and go get services. The other part of it is that we don't know that we are positive. So there's a whole national commemoration around getting tested. June 27th is the National HIV Testing Day, when we rally and say, please go and get tested. Don't wait for that day. I mean, there's so many testing sites available. It's free. You don't have to have insurance. The task force test and a number of other organizations provide free tests. And on the coalition's website, we have all the testing sites and the hours and everything posted there. So please get tested. So now that they gave us the HIV numbers, from 2002 they started to collect it. You can see that you're getting more women in those numbers. You're not getting more than you're getting in the AIDS numbers. The most disconcerting thing now is that they're even giving us HIV positive numbers for our young persons up to age 24. Then, if you really, really want to put our heads in the sand and pretend it's not there, I'll give you a couple of numbers around sexually transmitted diseases, which you also saw in the video. And this is a marker because it's the same way that HIV is transmitted. Between 2006 and 2007, those are just 2 years, apart that we have information. About 2,000 plus was reported for gonorrhea in our region in 2006. In 2007, it was over 2,600. And then women amongst those numbers, if you took 100 of the gonorrhea cases, 57 of them were women in 2006, 59 in 2007. And listen to this, blacks. There were 1,000, almost 1,500 cases in blacks, and compared with whites, it was only 464. This is gonorrhea. Am I scaring you? No? Oh, okay. So really, also if you look at chlamydia, it's the same thing. And the chlamydia reported in 2006 and 2007, if you took 100 of those cases, children 15 to 19 years old, there will be 39 of them amongst that 100. Children 20 to 24 years old, there will be 37 of them amongst that 100. And if you combine, for those of you that are good in arithmetic, if you combine from age 15 to 24, out of that 100, there will be 76 cases of chlamydia. What I want to, leave us with is what I would recommend. I've been doing HIV/AIDS since, I'm a public health professional, and I have been working in HIV/AIDS for the last 15 years or so. And my call to action for us as a community is that it involves you, it involves me, it involves our churches. You heard that in the video. We need to get tested. We need to seek treatment if we're positive. Because there are medications available and there are assistance to get you the medications if you're positive. Don't keep quiet. Get treatment, get services. Because people are now living long, long lives with HIV and AIDS now. And I look forward to listening to the panel discussion. Thank you.